welcome to KXAN News Today. So happy to have you around on this Saturday. Jane Washington is taking a little break as we take a look at the Circuit of the Americas. I'm Sally Hernandez here with a special guest because February is American Heart Month. Heart disease is the leading cause of death for men and women in the United States. And the goal of American Heart Month is to motivate Americans to adopt healthy lifestyles to prevent heart disease. So Dr. Priyanka Satish is here, preventative cardiologist at Ascension Texas Cardiovascular. Thank you so much for being here.
Thank you. I'm happy to be here.
Yeah. Okay. So a lot of people we were just talking about are getting ready for the marathon tomorrow. Obviously, they've been training your body. What can you tell us as far as how exercise, what it plays in the role of a healthy heart?
That's a great question. Exercise is one of the most important things that one can do for their heart health and honestly for their overall health. Exercise helps build muscle, exercise helps improve circulation, and there's a lot of data that the more people exercise, and we recommend a moderate amount of activity and a moderate amount of exercise at least 5 days a week.
Okay.
Something that we say is 150 minutes of moderate exercise. So how do you know you're doing moderate exercise? You want to be able to have a light conversation, but you don't want to be too comfortable.
Got it.
So 150 minutes of moderate exercise a week is the least that's recommended for heart health.
And when we talk about preventative measures, we know that you've launched a preventative cardiology clinic here in Austin. What exactly is that and what can you tell us about it?
So when you think of regular cardiology clinics, we usually see patients with heart disease and who already have complications of heart disease. Our preventive cardiology clinic aims to reverse that, where we're starting early. We're trying to prevent heart disease from occurring in itself. So we identify risk factors early, we screen for heart disease, and thereby we make an impact on future risk and future morbidity from heart disease. We've now seen hundreds of patients where we help them identify their risk, and then we help them develop something like a personalized plan that's in line with their goals, that's in line with their lifestyles, and we help make a difference in their future risk.
We've talked about how this is a #1 killer. What is it, doctor, that we are just not getting right? What can we do to make sure that our heart is healthy, especially in the younger population? Are you seeing heart disease in younger people, or is it mainly in the older community?
You know, heart disease can affect people of all ages. Age is definitely a risk factor, so as people grow older, the risk for heart disease does become greater. That being said, there are several risk factors that can predispose even a younger person to heart disease. So high blood pressure, high LDL cholesterol, diabetes, obesity, metabolic syndrome. These can definitely increase the risk for a younger person. And in certain cases, there are risk factors that are not very obvious. So women, for example, who have pregnancy complications or preeclampsia, they are at increased risk for heart disease even at a young age. Similarly, people with autoimmune diseases, they can be at an increased risk for heart disease too. So being aware of these risk factors, adopting a healthy lifestyle, exercising like we talked about, these can be very important in helping young people prevent heart disease.
Is there anything else that we can be doing on our end? I know when you go maybe to the doctor's office and they tell you, here's your let me check your blood, and they give you those numbers. I don't know exactly if everybody knows what a healthy number is for them. How do we find out?
So it's really important to know your numbers. There are 3 numbers that are very important. So your blood pressure, we want that to be less than 120/80. Your LDL cholesterol, we like that as low as possible, less than 100 at least.
Is that the good cholesterol or the bad one?
The LDL cholesterol is what is commonly known as the bad cholesterol, but that is one of the most important risk factors for heart disease. And then your diabetes or your A1C number, we ideally like that to be less than 5.5. In addition, all the healthy lifestyle things we talked about, and in some cases, we'll actually screen people for heart disease. There's ways to do that where we can look for heart disease even if somebody has no symptoms.
Oh, wow.
So heart disease can be silent, and even if you're very active, you can have heart disease. Screening is one way to detect that early, and then we can adopt preventive measures to prevent it from causing any trouble in the future.
Perfect. Talk to your doctor about that. And Dr. Satish, thank you so much for joining us. We learned a lot today.
Thank you very much.
We'll be right back.